IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello everyone, and welcome to another episode of All Things Policy. I'm your host for today. My name is Suman, and joining me is Apurva Kumar, who is the staff program manager and runs the PGP program at Takshashila. Hi, Apurva.
Hello, Suman. Thanks for having me again.
Yeah. So today was quite momentous, and it's a big day in terms of policy and all other things that we are interested in. It was the budget day, and everyone is keeping an eye mostly on numbers such as the income tax rates or the fiscal deficit numbers, etc. But what gets missed out for most of us, and what makes this interesting for policy watchers or development economists, is the way we track the government's involvements in various social initiatives too. So that, for some reason, gets missed out in our popular discourse, but that is a very, very important part of auditing or checking as to how our money is getting spent. So in today's episode, we illustrate the need for tracking, and we also talk about one of the very important social sector spending from the Indian government, which is various nutrition schemes that we have. To reference our discussion, we are using the report which came out yesterday at the IndiaspendIndiaspend.com site. So we will link this article that we are referring in the show notes. Please take a look. Okay. So firstly, we need to get some basics right. Why is social sector spending important? Okay. So to what level, what are the areas that we normally spend on? That itself is an interesting area of discussion. Apur, what do you think?
I think before we talk about social sector spending, I have to sort of admit, maybe it's my bias, but for the past couple of years, Suman, I personally believe that, again, I said that it's a bias, right? But I would say that I'm not very impressed by the quality of economic survey of the past 2 years. The quality of economic survey up till Arvind Subramanian used to really very good. I still remember I used to look forward for economic survey, especially the chapter on social sector spending, because some very quality insights and analysis would be there in those reports. For the past 2 years, it's slightly being not a great sort of economic survey, I would say. Having said that, I mean, different people have different preferences. Talking about social sector spending, I think when you say social sector spending, we mean spending by the government on education, on health, and on nutrition. It is extremely important for a country like India, where the spending on most of these aspects have been chronically and perennially low. Like, and there's a legacy that the spending in healthcare and in education has been really very low. Right. So it becomes really very important for all of us in public policy to monitor as to how and what quantum of spending is being directed to most of these areas such as health, education, and nutrition. And especially in a time during pandemic, so it becomes very important for all of us to look at how government is spending. And social sector spending is also important because it helps in creating or sort of creating our and distributing public goods such as public health and sanitation. It also has its own positive externalities, and that's where its importance is there. Apart from that, adding report after report and one NFHS round after another NFHS round, we know that some of the states have done pretty well in improving the health indicators and nutrition indicators, but most of the states, especially the EAG states and states in North India that have historically underperformed on these fronts, they still have a long way to sort of cover. So this kind of spending becomes important to see how policies and schemes are being directed to address most of the problems in states like Uttar Pradesh, Bihar, and others. And this is an election season. It becomes all the way more important to analyze and understand how Of course, I mean, it's a union budget, but it becomes important to see how these funds are being dispersed in some of these social sectors.
Yeah, and the report actually mentions that 68% of all deaths below age 5 are because of malnutrition. Now, that is a very, very depressing, sobering piece of information. If we have to, fulfill our aspirations or all the high aspirations that we have as a country, if we don't get that basic thing right, I think it's a huge failure on our part. So, first of all, spending on nutrition and tracking this nutrition is very, very important. Of late, I mean, after the Ayushman Bharat and stuff, there seems to be a little more stress on curative health rather than preventive health. So, in that light, I mean, looking at preventive health itself as as a goal or as something that we need to achieve. In that light, if you look at it, nutrition plays a very, very important role. Right. So before we go into the budget as it is, going into the history of these nutrition schemes, could you just give us a broad overview of what these nutrition schemes are and how we've been doing on that in terms of, how the reach and the objectives of the scheme as such, of these schemes?
Right. So most of these scheme, and when I say scheme, these are centrally sponsored schemes. So there were a bunch of schemes till last year, I would say. So the most famous is ICDS scheme, which is the oldest school feeding and nutrition scheme of India, and this is, I think, world's largest child feeding scheme. So ICDS was one. Apart from that, a few years ago, POSHAN Abhiyan was launched. There were schemes for adolescent girls. Now these are like schemes for particular category. So schemes for adolescent girls, some scheme to upgrade Anganwadi centers, so on and so forth, right? And but like these were, I mean, they were trying to solve multiple sort of problems, and that's where we were not able to see the optimal outcome. So last year, what happened was, last year during the budget, the finance minister announced that they are going to club all these schemes into one scheme, which they are going to call Saksham, Anganwadi, and POSHAN 2.0. So they have consolidated all these schemes into one, and that's so it's POSHAN 2.0. That's the largest, that's kind of an umbrella nutrition scheme of India. Right. Apart from that, as I said, that there were several schemes that was part of ICDS and others. So within ICDS, there was something called supplementary nutritional programs, because hot cooked meal were given to the children, take home rations were given to the children, supplementary nutrition was given to lactating and pregnant women. They were also take home ration provision, right? So all these were parts of the earlier nutrition schemes, ICDS and others, as I explained. Everything is now part of POSHAN 2.0, and I think, yeah, POSHAN 2.0 was launched last year after the budget.
Yeah, so just for our listeners, the ICDS is the Integrated Child Development Scheme, and POSHAN expands to Prime Minister's overarching scheme for holistic nourishment. Okay, that's quite a mouthful for a scheme to be said. Yeah, so going into how much we have spent and what it implies is that the findings that the IndiaspendIndiaspend report gives tells us that at full coverage, we needed some 40,000 crore rupees, etc. But the approved budgets for this was just about 17,000 crores, which is 41% of actual requirement. That means even at the budgeting level, we are not making a wholehearted effort towards nutrition. And when this actually goes down to the states, etc., the proportion that goes down is in a lot of states was even less than half of what was required. Okay, so based on what we need, right now we are just looking at budgeted thing, and then we are looking at allocated, and then what is actually spent again, what is actually released again is just a small fraction of it. And the release versus the spend, if you see, only 56%. Once the money is released, you're looking at only 56% actually being spent on the ground. So I guess this discrepancy between budgeted, allocated, spent, etc., comes because of time delays too. Because by the time the budget is approved and then it goes down to the states and further down, there is some time delay. But even having said that, the way we are going with all these three metrics seem to not be the most ideal situation that we have, especially given the pandemic, because people have, of course, there is that scheme where they're giving out rations, etc. But it's considering students are not going to school in some parts of the country, they're missing out on nutrition, which will have huge ramifications through their life, etc. Right? So, what is the whole thing about dietary intake, and how should we go about this to make it more efficient and effective?
Right. So, Suman, I think if to answer that question, I have to sort of take the help of the latest Nfhs findings, right? And you know, the latest Nfhs reports, the state wise reports, the fact sheets are quite revealing, right? So, if you there's a metric called total children aged 26 to 23 months, which is like 2 years, from 6 months to 2 years, receiving an adequate diet, right? An adequate diet comprised of all kinds of wholesome meal, right? So there's a metric called, as I said, there's a metric called total children aged 6 to 23 months receiving an adequate diet. Now, in a state of Uttar Pradesh, that percentage is just 6%, right? In NFHS 4, which means like 5 or 6 years ago, it was 5%. Now, this is alarming. This is really alarming because sort of, a big proportion of children are not getting adequate diet. And there's a huge body of literature in nutrition, sort of, nutrition research and nutrition policy world that talks about the association and correlation between inadequate diet and malnutrition and stunting, right? So which means that if your child is not getting adequate diet, there is the likelihood, there's a high probability that the child will be malnourished. His or her senses won't be developed, which means as an adult he's not going to have a good sort of a job, and on an average his wage would be like really low than other children. So it's kind of
Correct.
a, there's a massive sort of a loss and cost related to that, and it's quite intergenerational, because if the woman is malnourished or anemic because she's not got adequate diet, then the child is going to be, malnourished, right? If you compare this, so as I said that in Uttar Pradesh it's 6%, as per in 2019 2021. This is, I think, the lowest percentage in the whole of EAG state, because I was just looking at Madhya Pradesh and Bihar. They were doing slightly better than Uttar Pradesh. Right? If you compare this metric with the state like Tamil Nadu and Kerala, although they are not also doing that great, but I think Tamil Nadu and Kerala, they had like what, 17 or 19% of children who have got adequate diet, which is still 3 to 4 times more than the children in a state like Uttar Pradesh, right? So this is a massive problem, and because there are Anganwadis, and because of supplementary nutrition program, I think we have, as a policy measure, we have to strengthen SNP and ICDS more to sort of address this problem. In addition to that, I think of late the Indian government and some state governments have also started some behavioral change sort of interventions to promote intake of adequate diet. So there are sort of interventions that quote unquote nudge the parents to help the children take adequate diet. But these nudges are only successful. I mean, they are successful in
To a certain
to a
limited
certain limit,
extent.
to a certain limit, because if the food inflation is high and the parents are not able to afford the diet, it won't make any sense, no matter how much nudge you provide to that community or to that parent, right?
Given the pandemic and given the loss of wages that have been occurring across the country, and the informal sector being more badly hit, these kind of interventions from the state are the need of the hour. I understand. We get that there is an opportunity cost for everything, but this is a very important human development indicator, and we cannot afford to have lower spends on things like this, because this affects, as you said, intergenerationally all people. So while we have not looked at numbers closely for today's budget, we just hope that more spending and better spending will help us move the needle just a little bit, so that you know uh, nutritionally we are doing a little more than what we were doing earlier.
Right, Suman. So, and to conclude all of that we have discussed, I would conclude with my recurring sort of a theme that I've been talking about. That the Indian state of late has been spending on a very special kind of welfare measures. Delivering private goods and services using public sort of infrastructure and funding. I think that has to be addressed, and some of these aspects need to be addressed using. Need to be sort of distributed and dispersed using public goods, so that we have a healthy future and a happy future, I would say.
Yeah. Thank you. Thanks, Apur. With that, we will conclude our episode for today. Do check out the links that are there in the show notes. Thank you. Thank you for joining us.
Thank you so much.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaInst or our website takshashila.org.in.
Hey everybody, it's been another great week on the IVM Podcast Network. On The Habit Coach, Ashton talks to endocrinologist Dr. Altamash Sheikh. They discuss the various triggers for thyroid diseases and ways to keep our body safe from hypothyroidism. On Misconduct, we meet Unniyarcha, legendary warrior of Malayalam literature. Raghavi and Nisha tell us how she took revenge against the man who killed her brother. On Press Decode, Sarah Bagda and Prafulla talk about illegal immigrations with reference to the Indian family that died while crossing the US-Canada border. On Ikka Economy, Abhinav and Dr. Junjunwala discuss the MSP farm law and its repercussions. And on Say No to Drama, Chetna tells us how we can make peace with the bad habits we just can't seem to quit. Also, just one quick announcement for everybody. We would like you to check out the new version of our Android app. It's available on the Play Store. It's a really interesting take on how to listen to podcasts. Do give it a look and let us know what you think. We're open to feedback on all of our social media channels. We're IVM Podcasts on Twitter, Facebook, Instagram, and LinkedIn. Also, do remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Word of mouth really does help. And don't forget to rate us on any of the platforms you're listening to us on. And you can also check us out on YouTube. And we have a number of channels there at ivmpodcast.com/YouTube where you can take a look at them. And finally, we'd like to thank our sponsors this week, Bank of Baroda and CoinSwitch Kuber. Thank you so much for making this possible.
जिस तरीके से हमारे माँ बाप ने अपने करियर की सीढ़ियां चढ़ी थी, वैसे आज के जमाने में तो पॉसिबल है ही नहीं गुरु, क्योंकि हमारा जमाना इतना कॉम्प्लिकेटेड है। आज क्या नहीं है, कंपटीशन है, सोशल मीडिया है, इतना इंफॉर्मेशन ओवरलोड है कि करियर का टेंशन ज्यादा होता है, उस पर काम कम। टेंशन लेने से कोई फायदा तो है नहीं। क्या करते हैं, ठंडे दिमाग से सुनते हैं प्रोबेशन से प्रमोशन तक पॉडकास्ट को हर सोमवार, जहाँ पे सिर्फ प्रैक्टिकल बातें होती हैं आपके करियर की। और कौन करता है वो? मैं आपका होस्ट अभिनव त्रिवेदी। ये पॉडकास्ट आप सुन सकते हैं IVM पॉडकास्ट की वेबसाइट, ऐप या फिर किसी भी अन्य पॉडकास्ट स्ट्रीमिंग प्लेटफॉर्म पर।